Good evening, one and all present here. Today's session will be taken by Vaidya Gopikrishna sir, HOD in Roga Nidana in Guru Go Rakshanatha Institute.
Hello.
Good evening, one and all present here. Today's session will be taken by Vaidya Gopikrishna sir, HOD Nidana in Guru Go Rakshanatha Institute of Medical Sciences, Uttar Pradesh. Sir has already taken a session on Doshagati, Rogamarga, and Srotadushti. He has explained it in a very easy and short method. Please do check on it. Today, he will be continuing with topic on Rajayakshma, Shosha, and common lung disorders. Sir, now you can start the session.
Okay. So it gives me an immense pleasure for having an interaction with all of you. Before doing the session, Mukam karoti vachalam pangum langhayate girim yadkripatamaham vande paramanandamaadavam. Vagartha viva sampraktau vagartah pratipatte jagatah pitarau vande Parvati Parameshwaram. When you am deeply having a sense of gratitude to the organizers of Panchajanya who have invited me to have a sessions. Initially, I have discussed on the Doshagati, Rogamarga, and Srotodushti. In the today's session, we are going to discuss about the Rajayakshma, Shosha, and common lung disorders. So, uh, I am not going into the details of the all the uh, textual descriptions. I will be giving you the interpretations of those what actually so these Raja Yakshma Shosha and that means, and in brief regarding Samprapti Ghataka of Raja Yakshma and common lung disorders which are being mentioned in your syllabus point. Only those aspects I am going to discuss today. So whenever if you look into this, so Raja Yakshma. So, the term Rajayakshma refers to the text says Aneka Roganugato Bahuroga Purogamaha Durvidniyo Durnivaraha Shosho Vyadhir Mahabalah. It is being mentioned that when you think about the word meaning, multiple diseases they are following this particular disease itself. And Bahuroga Purogamaha, so that means follow multiple diseases they are being the present prior to the manifestation of the disease as such. Durvidniya Durnivaraha, which is considered to be very difficult to diagnose. Durnivaraha, very difficult to treat itself, and highly virulent disease. So that means that here, when you think about the Rogibala and Rogabala, so here the Rogabala will be very much increased than Rogibala. So its synonyms are being mentioned. That is Samshonshana Drasadinam Shosha ityabhidhyate. When you think about it, there will be the dryness or dhatukshaya of all the seven dhatus that will be observed in this particular disease itself. Kriya kshaya karatvacha kshaya ityuchyate punah. Whenever if you see that there will be the reduced functioning of the dhatu itself that is going to be present. So that's why this is also being named as kshaya. राज्ञः चन्द्रमसो यस्मात् अभूदेश किलामयः. This particular disease is specifically observed in the Chandra or moon. That's why it is, and he is considered to be Nakshatra Raja. Hence, as this is affecting the king of certain uh, area, that's why it is also being termed as Raja Yakshma itself. and it is being mentioned in this Yakshmanam Raja, Raja Yakshma by Vagpata. That is being mentioned that Yakshmanam Raja. It is considered to be the king of all diseases as such. Charaka Samhita that says that Raja Yakshma Roga Samuhanam. Whenever the person is suffering from the Raja Yakshma as such, multiple diseases they will be present in an individual. When you think about the meaning of the Raja Yakshma, so that is being mentioned that all Dhatu Kshaya will be present. So that means Rasa Rakta Mamsa Med Asti Manja Shukra, all Dhatu Kshaya that will be observed there. So that means whenever the person is having macronutrients, so that means the carbohydrate, fats and proteins, they are going to get depleted, and there will be the nutrients, that is micronutrients, that is vitamins, minerals, etc. They are going to have the deficiency in the body. Due to this particular deficiency, the body will be exposed to multiple microbes, maybe through the nose, maybe through the mouth, etc. From multiple areas, the microbes they are going to get entry into the body. Thereby, the person may develop multiple diseases at a particular time due to the immune compromise. That means, due to the immunodeficiency, the person may develop multiple diseases. In other words, to say most of us are having the opinion that Rajayakshma is nothing but tuberculosis. It is not so actually. Tuberculosis is one such condition which is being mentioned under the umbrella of Rajayakshma. Whereas when you think about the main pathogenesis, all the body tissues are going to get depleted. So thereby the person may have the exposure to multiple the disease pathogens, thereby the person may develop multiple diseases as such. That is the actual word meaning of Rajayakshma. When you think about the Nidana of Rajayakshma, four Nidanas are being mentioned. They are also considered to be the Sankhya Samprapti of Rajayakshma. So that is being mentioned in Charaka Samhita. That's Ayatha Balam Arambham, Vegasandharanam Shayam, Yakshmanaha Raj Karanam Vidya, Chaturtham Vishamashanam. So that means Ayatha Balam Arambham. So that is actually because of the Sahasa. Vega Sandharana, that is considered to be Vega Rodha, that is suppression of the urges itself. Kshaya, so that means the Dhatu Kshaya specifically. And fourth one, that is the Vishamashana. So the same thing that is being mentioned in Madhava Nidana, that is Vegarodhat Kshayat Chaiva Sahasa Vishamashana. Tridosho Jayate Het Yakshma Gado Heti Chatushtaya. So that is these are the four again the four the Nidanas itself of the Raja Yakshma. So here the Ayatha Balam Arambham can be equated with Sahasa itself. Whereas Vega Sandharana that can be attributable to Vega Rodhajanya Raja Yakshma. Kshayajanya in the sense that is also being specific term Kshaya itself that is being mentioned there. And Vishamashana, again, the Vishamashana is also being mentioned in the Madhava Nidana. So these are the two sets. That is the one from the Charaka Samhita and second one from the Madhava Nidana. So these are the four subtypes of Rajayakshma. When you think about the Pura Rupa of Rajayakshma, so that is being mentioned as Pura Rupam Pratishyayo, Daubalyam Dosha Darshanam. When you think about Pratishyaya, so that means the person will be having the running nose itself. So that means the probable source of the Nidana Sevana that will be through the nose itself. So in that way, we can able to say that the probable source of entry could be NASA. Daurbalyam. So it could be categorized under specifically because of the what you say that the reduced nutrients the absorption wherein the person may have the carbohydrate depletion which in turn results in the fat depletion. Later the person may have protein depletion. In this way, the person may have the Daurbalya that in due course of time as such. Dosha Darshanam. So Dosha Darshanam refers to what? The presence of what you say that either the Chaddi or the what you say that Nishtivana, etc. That person may have that. So that means the person may have sputum production, the person may have the vomiting, etc., etc. Adosheshwapi bhaveshu kaye bibhatsa darshanam. You can see the various kinds of deformities or disturbed functions in the body. Even though the person may not be having the dosha vitiation itself, still the person may have the, what do you say, that the bibhatsa darshanam. So that means various deformities can be observed. Vrinitvam ashnataschaapi balamamsa parikshayah. So that means the person will be having aversion to take the food. Balamamsa parikshaya. The person will be having the reduced strength, reduced muscular bulk will be observed. Stri madhya mamsa priyata. The person will be having the excessive desire for the sexual intercourse. The person will be having the excessive desire to consume alcohol. The person will be having the excessive desire to consume meat itself. Priyata cha avagunthane. So that means he will be having the liking towards covering one's body, whereas he will be having the dreams of, that is makshika guna keshanam trinanam patananicha, that is makshika kesha trina, etc., that will be falling in the food. That kind of the dreams the person may have. Prayo annapane, so that is what, keshana nakhanam cha abhivardhanam, the person will be having the excessive growth of hair as well as excessive growth of the nakha. Patatribihi patangaishcha shwapadaishcha abhigarshanam, that means swapne. So that is, the person will be having the dreams of having the, what do you say, that the birds, patatribihi patangaihi, that is insects, shwapadaihi, that is the four legged animals. So he will be having the fight with those, or the quarrel with those aspects, with those kinds of the animals, etc. Keshasti Rashina Basmanaschadi Dor Adhirohanam. So that means in the Swapna, he will be having the Keshasti Rashi. That means he will be observing the Kesha, Asti, that is the group of the Kesha and Asti itself. Bhasmanaha, that is, these are going to get burned, as well as he may be sitting on these, the Kesha, Asti, etc. Jalashayanam, Shailanam, Vananam, Jyotishamapi. Shusyatam. So that means the person will be having a dryness, that is of the, what you say, that the lake, etc. That means the reduced water itself. And Shaila, so that is the Parvata, etc., that will be considered to be having the less growth itself. That means less amount of the trees, etc., that will be present. Vanana, so that is the what, forest, that is having the less amount of the trees. Jyotishan, that is the person will be having the light, that is going to have the minimized as such. Shiyamadana patatam yacha darshanam. So that is the, these are the lakshanas that are considered to be pururupa. That means whenever if a person is having this particular, the forthcoming Rajayakshma, these are the different lakshanas are being observed. When I think about the, all these lakshana as such, the person may have an entry of these pathogens from the multiple sources. Either it might multiple sources, in the sense there may be a possibility entry of these pathogens through the multiple bahya srotas itself, which in turn results in the disturbed functioning of almost all the abhyantara srotas itself. When you think about the Samprapti of Rajayakshma, Kapapradane doshaistu Ruddeshu Rasavartmasu Ativyavayino Vapi Shine Retasyanantara Shiyante Dhatavah Sarve Tatah Shusyanti Manavah. When you think about the Lakshana, so that is Samprapti, Ativyavayino Vapi Shine Retasyanantara. So that is Ativyavaya, that is Shukrakshaya Janya. So there will be the Rajayakshma that is going to get manifested. This type of the Rajayakshma can be considered as Pratilomakshaya Rajayakshma, wherein initially there will be Shukrakshaya, which later leads to Majjakshaya, then Astikshaya, then Medakshaya, Mamsakshaya, Raktakshaya, and Rasakshaya, that is going to get observed. Whereas other aspects, that is Sahasajanya or Vegasandharanajanya or Vishamashana-janya Rajayakshma, we are going to observe Anulomakshaya. Anulomakshaya in the sense the person initially he will be having the Raktakshaya, Rasakshaya, followed by Raktakshaya, Mamsakshaya, Medakshaya, Astikshaya, Majjakshaya, and Shukrakshaya. So, like this, these are the two different uh, sets of Samprapti that can happen in the person suffering from Rajayakshma. When you think about the Sahasajanya Rajayakshma, Yuddha, Chayana Bharatva, Langhana Plavanadibihi, Patanairabhigayatairva, Sahasaihiva, Apyatha Tatha Parai, Ayatha Valamarambai, Janto Rurasi Vikshate, Vayu Prakupito Dosha, Udirya Ubhau Pradhavati. When think about all these, so that is considered to be Ayatha Balamaramba Prano Parodhinam. So that is considered to be responsible for the severe disturbances, as far as that means that can be sometimes life threatening also. When you think about the Nidana as such, the person will be actually doing the um activity more than one's capacity. For example, Yuddha, or heavy lifting the heavy weight, or doing the langhana, or swimming, etc., or abhigamataihi. That means the trauma, physical trauma, or about falling from the or frequent falling itself. When you think about these different aspects, so we are going to see, for example, let us say bhara or adhva, etc., the excessive walking or the lifting heavy weight, etc. So initially the person may have the, what do you say, that the entry of these pathogens, what we can say, the bahya nidana, maybe through the oral cavity itself. So that means one of the main functioning of the nose, that is three main functions, that is what we can say, that is filtration, humidification, and warming of the air, that is going to get disturbed or hampered. In turn, that is the because of the non filtration of the dust, etc., or pores, that is the droplets, etc., these pathogens that will be entering into the respiratory passages itself. So likewise the person may develop, what you say, that the initially the person may develop the pranavaha sroto dushti itself in that particular regard. As far as lakshana are concerned, they are considered to be different because of the involvement of the different body parts. For example, if the person is having the presence of pathogens in the head region, the person may develop headache. If the person is having the pathogen in the gala or throat, the person may have kanthodvamsa, kasa, swarabheda, as well as arochaka. That means kanthodvamsa in the sense that is hoarseness of voice. Kasa, initially the person may have the dry cough. This will be followed by productive cough itself. Swarabheda. So that means the affliction of, what you say, that the larynx or vocal cords. The person may have the swarabheda. Arochaka. That is tastelessness. That means the pathogen, the presence of pathogen is present in the oral cavity itself. Parshvashulam cha parshvastho. If the pathogens are being present in the respiratory passages itself, the person may develop the pain on the either sides of the chest itself. Kude varchobhedam, the person may have atisara or diarrhea. Jiramba ajvaram sandhistaha, if the person is having the affliction of the sandhi, the person may have jiramba as well as jwara. That is considered to be the fever manifestation. Urastaha cha urasurujam. If the pathogens are present in the uraha pradesha, the person may develop chest discomfort. Kshanana durasaha kasat. Kafam shiveta sashonitam. Because of the effortful cough, which is considered to be the chronic cough, the person may develop the blood mixed sputum. Jarjareno rasa krichrashulam atipiditaha. Because of the injury to the chest, the person may develop severe chest discomfort. So like that, so these are the different lakshanas that we are going to observe in case of Sahasajanya Rajayakshma. That means initially the person may have the entry of these pathogens in the pranavaha srotas. So thereby the person may develop the different kinds of the lakshana. When you think about the Vegasandharana Janya, Rajayakshma, so that means initially the person may have Hrimatva, Va, Granitva, Bhayadva, Vegamagatam, Vatamutra Purisha, Nigrinnati Yadanara. So that means because of the Hrimatva in the sense because of the shy nature, Granitva because of the aversion, sometimes because of the fever. fear, the person will be suppressing the urges specifically of Vata, Mutra, and Purisha. When this is happening, so this is responsible for the Apanavata Prakopa, so which in turn results in the affliction of a Samanavata, which later results in the infliction of a Pranavata itself. So that means initially there will be the Apanavata Vikriti, which in turn results in the Samanavata Vikriti, which is resulting in the Ahara Parinamakavara Bhava dysfunction. So that means Ushma, Vayu, Kleda, Sneha, Kala, and Samayoga, they are having the disturbed functioning. Thereby, the person may develop the digestive impairment as such. Later, the person may have the pranavata affliction. So, like this, because of this particular Vega Pratikata, it is being mentioned that there will be the affliction of a Kafapitte Samirayan. As such, we have discussed Samanavata Vikriti. There may be a possibility of Pitta vitiation. Pranavata Dushti, there may be a possibility of Kapha dosha vitiation. So, like that, because of this affliction, the person may develop Pratishayam Chakasam Cha Surabheda Marochakam Parshashulam Shirahashulam Jaramamsa Avamardhanam. So, because of all these reasons, the person may develop these different lakshana. Angamarda, that is body ache, muhuchadim, that is frequent vomiting, varchobhedam, that is the atisara or the diarrhea that is going to get manifested. So this is about the Vega Sandharana Janya Rajayakshma. So here the main reason is the Apanavata Vikriti. When you think about the Dhatukshayajanya Rajayakshma, so here Irsha Utkantha Bhayatrasa Krodha Shoka Atikarshana Ativyavaya Anashanat Shukram Ujascha Hiyate. So because of all these reasons, there will be the Dhatukshaya. Specifically, if the person is having the Ativyavaya, initially there will be Shukrakshaya, which later results in the Majjakshaya, so up to Rasakshaya and so on. So when you think about other aspects, Irshot, Bhayatrasa, etc., there will be the normal Dhatukshaya that is going to get observed. Because of this type of the manifestation, the what do you say that the Nidana, the person may have Snehakshaya. Initially, there will be Snigdha Gunakshaya in the body, which is resulting in the Vata Vriddhi itself. Later, the person may have Pratishaya, Jvara, Kasa, Angamarda, Shiroruja, Shwasa, Vidbheda. Vidbheda refers to the what you say that the unformed stool, or otherwise, what we can say the Varchobheda or Atisara. Aruchim, Parshushulam Srakshayam, Karoti cha Amsa Santapam. So here, Amsa Santapa that refers to burning sensation that is going to get happen in the shoulder joint as such. So this is about the what you say the Dhatukshayajanya Rajayakshma. When you think about the Vishamacharajanya Rajayakshma, so here the term Vishamashana, what do you mean by Vishamashana? How that is leading to Agnimandya? Though the person is having the Vishamagni, how that is leading to Agnimandya? So when you look into the definition of Vishamashana, it is being mentioned that so the irregular food intake in terms of timing as well as in terms of quantity. If the person is taking the food in little quantity, the ama formation will not be there. But if the person is sometimes if he is taking too much large amount of quantity, then the what do you say that the Agnimandya that happens, thereby the person may have the ama formation. So that means when a person is taking too large amount of food at a particular time, this may be responsible for the what do you say that the Agnimandya. So that means he will not be having any kind of the fixed pattern of food intake in case of Vishamashanajanya Rajayakshma. Because of these aspects, that is responsible for the Srotansi Rudiradinam, Vaishamya Dishamam Gataha. Because of all these reasons, the Raktadi Vahasrotas, as such, that will be getting afflicted. Because of that, the Dhatu will not be getting proper nourishment, which is resulting in the Pratishaya. Pranava Srota subflexion we can able to predict. Praseka, that is resulting again Pranava Srota subflexion. Kasa, again Pranava Srota subflexion. Chardi Marochakam, that is the Pranava Srota as well as Annava Srota subflexion. Jvara as such may indicate what you say that the Rasabha Srota subflexion. Hamsabhitapam, that is indicative of Asthi and Majjava Srota subflexion. Chardanam Rudirasya cha, that is indicative of what is Annavasrotas as well as Raktabasrota subflexion. Parshvashulam, that is indicative of the Pranavaha and Rasavaha, sometimes even Annavasrota subflexion. Shirashulam, that is indicative of specifically Pranavasrota subflexion. Swarabheda, Pranavasrota subflexion. So like that, we can able to see the multiple Srota subflexion as such in this particular situation. It is being mentioned that further in your syllabus it is being mentioned Trirupi Rajayakshma. So when you think about this Trirupi Rajayakshma, Amsa Parshvavitapascha, the person will be having the burning sensation in the Amsa and Parshva region, shoulder as well as on the either sides of the chest. The person may have Santapaha Karapadayoho Santapaha. That is burning sensation that is happening in the Kara as well as Pada. So, Jaraha Sarvanga Gacheti. When you think about all these, the Lakshana, what we can say that is Pitta Dosha dominance we are going to see in this particular situation. This is considered to be the Shadrupi Rajayakshma. When you think about the Shadrupi Rajayakshma, Kaso Jvaraha Parshvashuram Swaravarcho Gado Aruchihi. Kaso, that is what we can say, the Pranavaha Srota subflexion. Jvaraha, Rasavaha Srota subflexion. Parshvashulam, as we have discussed, Pranavaha, Rasavaha, as well as Annavaha Srota subflexion. Swaragado, that is Swarabheda. Pranava Srota subflexion. Varchogadaha, that is Atisara, etc. Purusha Srota subflexion. Aruchihi, Pranavaha, as well as the Annavaha Srota subflexion, we are going to say as such. When you think about the Madhava Nidana, that says that Bhaktadvesho Jvaraha Kasaha, Shwasaha Kasaha Shonita Darshanam, Surabedascha Jayeta, Shadrupam Rajayakshmani. Bhaktadvesha, that is Aruchi, Jvaraha, Kasaha, Shwasaha, Shonita Darshanam, that is considered to be the either the person may have the hematemesis or hemoptysis. Swarabhedascha. So that is in relation to the Shadrupi Rajayakshma. Considering the Ekadashi Rupi Rajayakshma, Kaso Amsatapa Vaiswaryam, Yaraha Parshvashiro Ruja, Chardanam Raktakapayohu, Swasa Varcho Gado Aruchihi, Rupani Ekadasha Etani, Lakshmanaha Shadimaniva. So that is the Kaso Amsatapo Vaiswaryam, Kasaha, Kaf, Amsatapaha, burning sensation in the shoulder region, Vaiswaryam, Swarabhedaha, Jvaraha, Parshvaruja as well as Shiroruja. Chardanam Raktakapayoho. So that means the hematemesis or hemoptysis as well as the productive sputum. Shwasa Varchogado, Shwasa, breathing discomfort, Varchas in the Varchogado, that is the diarrhea or unformed stools, and Aruchi. So these are the Ekadashi Rupi Rajayakshma. Further, it is being mentioned that the Prasangat Gatra Samsparsha, Nishwasa Sahabhojana, Sahashayasanascha Vastramalyanu Kushtam Jwaram Shoshascha Netravishchanda Evacha. So here, this is one of the Nidana specifically which is indicative of the infective nature of a Shosha or Rajayakshma. When you think about the Samprapti Khataka, when you think about the wide varied clinical manifestation, dosha involved in this may be through dosha prakopa. Dushya or dhatu involved will be sapta dhatu kshaya, and srotas afflicted will be all dhatuvaha srotas. And sometimes, depending upon the nature of the lakshana, the person may have pranava srota affliction, udakavaha srota affliction, annavaha srota affliction, purishava srota affliction, mutravaha srota affliction, and svedava srota affliction. In a sense, all the bahya srotas may be afflicted, and all the abhyantara srotas may be afflicted. As far as srota dushti prakara are concerned, ati pravritti, for example, if the person is having atisara, we are going to observe the ati pravritti there. If the person is having the chardi, the person may have sanga and vimarga gamana. If the person is having the shonita chardi, what we can say, the hematemesis, in that particular sense, there may be a possibility of sanga and vimarga gamana. So, like that, the srota dushti prakara, maybe multiple srota dushti may be afflicted in a particular single patient itself. As far as Agni Mandya are concerned, Jaఠaragni Mandya may be observed, Dhatwagni Mandya as well as Bhutagni Mandya can be observed. As far as the Ama formation is concerned, Jaఠaragni Janya, Dhatwagni Janya, Bhutagni Janya Ama can be observed. In case of Udbhavasthana, suppose in case of the uh, apart from the Shukrakshaya, rest of the things the person may have either Amashaya or Pakvashaya affliction as a Udbhavasthana can be observed. Suppose if the person is having the Veka Sandharana, in that particular situation, Pakvashaya can be the Udbhavasthana because Vata dosha is being vitiated there. Whereas in case of the Kapha as well as Pitta dominant Pitta initiation in the Rajayakshma, there may be a possibility of Amashaya as a main affliction there. As far as Sancharasthana is concerned, Sarva Sharira, in the sense it is being mentioned that Rasa Rakta are considered to be Dravadhatu. In those situations, it can be Sarva Sharira affliction. Sarva Sharira may be observed as far as the Sancharasthana are concerned. Whereas Vyaktasthana is concerned, it could be again Sarva Sharira. That means because of the wide variety of clinical manifestation, we can able to say. As far as Roga Marga is concerned, it is considered to be the Abhyantara Roga Marga is affected, then the Bahya Roga Marga that will be afflicted, as well as the Madhyama Roga Marga that can be afflicted. For example, joint pain, we are going to see specifically if the person is doing excessive movement of the joint there. In that particular situation, the affliction could be Madhyama Roga Marga there. As far as Sadhya Sadhyata is concerned, it is asadhya in nature. Because look into these, the Samprapti Ghataka. When you think about it, the person may have the multiple sides of the involvement of this clinical manifestation. So that means which and all we are going to treat first. That is the reason we are going to say it could be asadhya in nature. As far as Vyadhi Swabhava is concerned, it could be Ashukari. So that means because of the multiple nutrient depletion, it may be the macronutrient depletion as well as micronutrient depletion. So, Vyadhi Swabhava, it could be Ashukari in nature. We are going to observe the complications rapidly. As far as Vyadhi Prakara is concerned, among the Sushrutokta Trivida Vargikarana of Vyadhi, it can be categorized under Adhyatmika Vikara. Among the Saptavida Vyadhi Vargikarana of Sushruta, it can be categorized under Doshabala Pravutta Vikara. Further, it can be categorized under Sharirika Vikara. Among the three types of the Vikara, Mrudu, Madhya, and Atimatra Vikara, Rajayakshma is categorized under Atimatra Vikara. Among the Purva Karmaja and Pratitpanna Karmaja Vikara, this is categorized under Pratitpanna Karmaja Vikara because of the deeds done by oneself in one's present life. So this is what we can say. Further sub classification of Vyadhi Prakara can be done if you look into the textbooks as such. These are the, for the namesake, I have given the different Vyadhi Prakara itself. So that means this will be helpful in planning the actual line of treatment as such. When you think about the Shosha, the term Shosha refers to the one where we are going to have the Samshoshadrasadinam. So here it is being mentioned that these are the different types of the Shosha they are being mentioned. Yamaya Shosha, Shoka Shosha, Vardhakyajanya Shosha, Vyayamajanya Shosha, Adhva Shosha, Brana Shosha, Uraha Kshata Shosha. In the sense, Vyavaya Shosha. Vyavaya Shosha in the sense, if the person is developing the, or to say that the Dhatukshaya because of excessive sexual intercourse. Shoka Shosha. In the sense, because of the grief, the person is having the Shosha, that is dryness of the dhatu itself. Vardhakya Janya Shosha. This is considered to be the Shosha is manifested due to old age. Vyayama Janya Shosha, because of the excessive exercise. Adhva Shosha, in the sense, because of the excessive walking, as well as Vrana or Urakshata Janya Shosha. That means because of the trauma or Urakshata or the trauma happening in the chest region, the person will be developing the Shosha. In the sense, whenever the person is having the extreme kinds of these activities, first of all, there will be the increase in the basal metabolic rate happens. So that means there will be cellular metabolism that is going to get enhanced. Whenever there is cellular metabolism is going to get enhanced, initially that will be leading to the depletion of macronutrients as well as micronutrients. Whenever there is macronutrients depletion, within a matter of 30 minutes, the person will be having the carbohydrate depletion. This will be followed by fat depletion. So that means the stored fat, which is being present in the subcutaneous tissues of the buttocks, breast, abdomen, cheeks, etc., that is going to get entered into the, what do you say, that the circulating fat, thereby utilization of that particular energy will be taking place. Later that will be followed by protein depletion. So in this way, the Vyavayajanya Shosha, in the sense, initially there will be increased basal metabolic rate, that is cellular metabolism is going to get enhanced, which is resulting in the nutrient depletion later. Shoka Shosha, in the sense where the person will be having the probability is there will be the decreased food intake. Whenever there is Shosha, this will be responsible for the what is sympathetic nervous system activity. Whenever there is sympathetic nervous system activity, what actually happens is the nutrients which are being consumed, they are not going to get converted into absorbable micronutrients form, which in turn results in the carbohydrate, fat, and protein depletion from the body, which are being present in the different tissue levels. Vardhakya Shosha as such. Whenever Vardhakya Shosha, in the sense, the person may be having the chronic debilitating illnesses. Already the person is having some kind of the Dhatukshaya naturally going to take place. Because of that, the person may develop the Shosha or Dhatukshaya. Vyayama Shosha, because of the excessive exercises as such, what actually happens is there will be initially the carbohydrate depletion, which is followed by the fat depletion within 30 minutes. As such, later that will be followed by protein depletion. Brana Shosha, Urakshata Shosha, in the sense the restoration or the wound healing, again this requires the nutrients itself. If it is frequently happening, naturally all these nutrients they are being required to heal those wounds itself. That means the person may develop in this way, the person may have the emaciation. Now coming to the common lung diseases as such, when you think about the pneumonia, it is considered to be the acute infection that is happening in the lungs. Specifically, if the person is suffering from any kind of the upper respiratory diseases, specifically in children, their immunity is comparatively compromised because of their poor nutritional status. The children may have the catching of this particular infection of the lungs rapidly. The causes may be cough, sputum, running nose, fever, etc. That is, we are going to observe. And on examination, we are going to see the abnormal sounds in the form of the crepitations we are going to observe on the lung field. Sometimes wheezing can also be observed in cases of the lung field where these abnormal pathological events are taking place. As far as the diagnosis is concerned, so this requires chest X-ray. So here we are going to see uh, this is what we can say the middle lobe may be affected here, and here on the left side it is the lower lobe that is going to get affected. So in this way we are going to diagnose the pneumonia. Of course, some kinds of the blood investigations are also necessary to say that the increased leukocytosis, then the regarding the other aspects regarding increased WBC count, etc. And ESR is going to get raised, etc. That is we are going to observe in this particular pneumonia. When you think about the chronic obstructive pulmonary disease, so here on the extreme left side, here is an image which is showing the absolute healthy lungs as such, and on the right side, we are going to see the COPD in what will be the nature of this particular, what do you say, that the respiratory passages. Usually, partially reversible airflow limitation that is specifically being present in this particular type of the disease. So, and there will be inflammatory response because of the inhaled toxins, specifically cigarette smoking. As far as clinical symptoms are concerned, the person may have cough with sputum, breathlessness can be observed. As far as the signs are concerned, the person may have decreased breath sounds and prolonged expiratory phase of respiration, as well as the wheezing can be observed. Diagnosis is based on the history properly. Physical examination, X-ray and pulmonary function tests are diagnostic of chronic obstructive pulmonary diseases. Among these two diseases, we are going to remember one that is chronic obstructive bronchitis, which is considered to be the one such COPD, and second one that is emphysema. So here, when you think about the chronic obstructive bronchitis, which is usually considered to be presented with chronic bronchitis with airflow obstruction. Here, the clinical symptoms will be productive cough for most of the days of a week for at least 3 months for consecutive 2 years. That means the person will be having the clinical manifestation for a period of 3 months in the continuous 2 years. Then we are going to say the person is suffering from chronic bronchitis. So here the diagnosis will be made by history, physical examination, and chest X-ray here is not considered to be a definite diagnostic tool in the diagnosis of chronic bronchitis. Whereas emphysema is considered to be the condition which is actually happening because of the what do you say, that the chronic respiratory diseases as such. Because of that, what actually happens is the alveoli are going to get enlarged. So this is actually leading to barrel-shaped chest. So that means where the anteroposterior diameter will be equal to transverse diameter. Normally, anteroposterior diameter as well as transverse diameter will be in the proportion of 5:7. If that is not there, if that is anteroposterior diameter will be equaling to the transverse diameter, then we are going to say the person is having the emphysema. So when you think about the normally, this particular the anteroposterior diameter will be equal to transverse diameter in case of children. That is normal. Whereas in case of the persons who are suffering from chronic respiratory diseases, that too chronic obstructive respiratory diseases, is specifically in case of emphysema, we are going to see the this kind of the chest as such. When you think about the here, it is an X-ray that is showing the increase in the length of the lung field. And when you see the specifically on the left side, we are going to see the totally the blankness. That means the blood vessels, etc., they are not visible. So that means the increase in the airspace is specifically being observed on the right lower side. As far as the pulmonary function tests are concerned, that are usually done by spirometry. So here FEV1, that means forced expiratory volume in 1 second, and forced vital capacity, and FEV1 and FVC, they are reduced in cases of the persons who are having the chronic obstructive pulmonary diseases. As far as pleural effusion is concerned, this is considered to be the accumulation of the fluid that is going to take place in the pleural space. So extreme right image, that is the above image, that is showing the pleural effusion as such. The cause may be multiple, maybe infection or maybe malignancy, etc. So the diagnosis will be made based on the physical examination, chest X-ray, thoracocentesis, that is the pleural fluid that is going to get tapped to know about the pleural fluid analysis. When you think about the chest X-ray here, when you see the left side of the lung field, we are going to see the homogeneous opacity. So that means the pleural effusion is being present on the left side in this particular X-ray. As far as bronchiectasis is concerned, one more common lung disease that we are going to observe, that is the definition of bronchiectasis goes like this: permanent and irreversible dilatation of a segment of bronchus. Permanent, irreversible dilatation of a part of segment of bronchus. So usually this particular bronchus has such larger bronchi that may be afflicted. There will be destruction of larger bronchi, which is considered to be manifested due to chronic infection as well as inflammation. Commonest causes are cystic fibrosis, specifically observed in the apex of the lungs as such, and immunodeficiencies, where the person is having the immune compromise and recurrent infections as such. Whereas chronic cough with large volume of thick tenacious sputum, which worsens on the change of posture. This is the characteristic clinical feature. The worsening of the cough on change of posture, that is indicative of bronchiectasis. As far as other clinical features are being concerned, breathlessness may be present, wheezing will be observed, and hemoptysis will be observed. That is, the sputum mixed with blood will be observed. Diagnosis of bronchiectasis is concerned, we can able to make the diagnosis by history, physical examination, and honeycomb appearance, specifically seen in chest X-ray. And CT scan is also helpful in the diagnosis. So this is the image which is showing the honeycomb appearance. So where you can see the honeycomb as such, when you see the on both the lung fields, this is specifically indicative of the person who is suffering from bronchiectasis. These are the different resources used for this particular the session, plus the Charaka Samhita as well as Madhava Nidana plus Sushruta Samhita is being referred. Over to you, Miss Vijeta.
Thank you so much, sir, for your precious time and giving this session. Thank you so much, sir. Sir, if any doubts
Thank
are there,
you,
then it
dear
will be passed
Panchajanya
on to
team.
you. Thank you, sir.
Yes, yes.
If any doubts are
Okay.
there, then
Shall I stop
they will
this?
be passed on to you. Yes, sir.
Okay, okay. I will stop sharing
Sure.
now.
Thank you, sir.
Okay, okay, okay. Right.
Yes,
Bye.
sir.
Hmm.
Sir, if any doubts are there, then they will be passed on to you.
Okay, okay.
I'll
Are you
let you
passing
know,
now
sir,
or
if there are
some?
any doubts.
Okay, okay, okay. Hmm.
Yes, sir. Whenever I will get it, then I'll just pass on it to you, sir.
Okay, okay. Right. Hmm. Hmm.
Thank you, sir, for giving your precious time.
Thank you, thank you. And it's my pleasure to have
Thank
an interaction with such a young audience. Thank you.
We are honored to have you, sir.
Okay, thank you.
Thank you, sir.
Okay,
Sir, I'm
right.
going to end the session.
Okay, okay, right. Okay. Hmm.